or what are y'all as holistic doctors?
Well, our definition of holistic doctor is one who takes into consideration the entire person, not just physically, but emotionally, spiritually, and also the circles that exist around that person, physically, spiritually, and emotionally. So for example, I interviewed a patient today, new patient, first visit, and I went through the history with him, but then I spent some time asking him, how was your relationship with your mom? How was your relationship with your brother and sister? How about with your dad? How about with your stepdad? Do you like your job? What is it that you do? If you could have an ideal job, what would you do? So it's more than just, health history. It's happiness with your life as it is today. If you could have things different, how would it be? What do you do to make your spirit sing? So it's looking beyond just the physical body sitting there in front of you, which most doctors don't do. We're taught in medical school to ask a specific script of questions in a certain order, to document those things in a certain fashion, and not to ask about spiritual things or things that may potentially be tense, like family relationships and things. So what I have found is that when we do that, man, not only does it give me a lot of useful information, but I just feel like the healing power of the relationship expands just exponentially. There's like a palpable feeling of relief almost when I ask these things to people. And when I was previously practicing as a conventional doctor who didn't ask about those, I felt that there was something missing, and now when I throw those questions out there, I wish there was some sort of imaging device that could see energy and auras and things, because I feel like when those questions come out, there's just this burst of really good energy. So that's the holistic part of the personal relationship between the patient and the physician. But in the treatment, we also incorporate any treatment modality that we believe is safe and would be effective. So we do incorporate all the popular alternative modalities, herbal medicines, homeopathic medicines, bioidentical hormones, nutritional supplements, massage, acupuncture, etc. But we're also open-minded to the creativity of the patient and the experience of the patient. So if one of my most striking experiences was a woman with Lyme disease who had spent 5 years trying to get well with other doctors, came to me and asked me what I thought about her traveling to California to have sheep stem cells infused into her body. And 5 years ago I would have said, "You're crazy." But this time I said, I've never heard of that before. I'm going to trust your instinct and just tell you that if you have assessed this and you believe it's safe, then I think you should try it. If you want me to review the propaganda or the data that they provided to you about the procedure and give you my opinion about whether I think it's safe, I'm happy to do that. But if this feels right to you, then go for it. So I do every day. People come to me with new things, and I just have to. I really try to stay open-minded and
Mm-hmm.
and incorporate all that. So